Namaste. So, let us start with somewhat revision of basics of palliative care. Myself Dr. Geeta Joshi, I am Chief Executive Officer of Community Oncology Center and Hospice at Ahmedabad. I had been a former professor and head of the Department of Palliative Medicine at Gujarat Cancer and Research Institute, and I also served the institute as a deputy director. Gujarat Cancer and Research Institute is the first government organization to have MD course in palliative medicine. Let us start the understanding of palliative care with this case report. A 25 years old Ravi fell down from a coconut tree and injured his spine. He had to undergo a spinal surgery. At the end of 3 to 4 weeks of treatment, he developed paralysis in both the lower limbs. Doctor said, now we have done whatever we could do, you can take him home and just look after him, nothing more can be done. Now, do you agree with this doctor's remark that nothing more can be done? If you all know what is palliative care is, then the answer is no. There is always palliative care can be given always to any patient who is suffering from prolonged illness or life limiting illness. Palliation came with from the word palliare, which is a Latin word. It means to cause something to appear less serious or offensive. So, here you are treating the person, relieving his pain and symptoms without curing the disease. So, palliative care physician is a bridge between a multi-speciality hospitals and a home care of a patient. One another word, hospice, you will learn in palliative care. It is again a Latin word which comes with from the word of hospitum, which means hospitality. और in हिंदी में बताएंगे कि आश्रय, शुश्रूषा आश्रम. It is a resting place for people who are very sick and dying. It is different from hospital. In hospital there is a always curative treatment, lots of investigation is going on, lots of procedure is going on. In hospice, patient is already suffering from advanced stage of the illness and he is given a care, more of a compassionate care till he dies. That is what hospice is. In Western world, the palliative care started by Dame Cicely Saunders, and she was a English nurse, social worker, physician and writer, and she started the first hospice in London in 1967. The name of the hospice is St. Christopher Hospice. In India, the palliative care was started by pioneers like Dr. L. D. D'Souza in Mumbai and Dr. M. T. Bhatia, my teacher in Ahmedabad, Gujarat. Dr. Rajagopal Padma Shri started Pallium India in Trivandrum, and these are the people who have worked very hard to make palliative care a speciality in medical field as well. In South, in Kerala, palliative care is very popular. There are number of centers right at the grassroots level, right at the village level, and it is called neighborhood network, and this is very popular program started by Institute of Palliative Medicine and Alpha Palliative Care. So, what is palliative care? WHO has given its definition. Then it is an approach that improves the quality of life of patients and their family facing the problems associated with a life-threatening illness through prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other symptoms. So, palliative care basically meant for the patient as well as family members or caregiver. It is aimed at relieving the pain and symptoms, and also addressing their physical, psychosocial and spiritual issues. So, the aim of palliative care is to make patient comfortable as possible. So, comfort always. What is health? Is it only the absence of the disease? Let us see what WHO says. The definition people often miss of health is a state of complete physical, mental and social well-being and not merely absence of disease or infirmity. This is what WHO says. So, when we are treating a patient, what we are treating is only physical problem. The things which are hidden inside are their social issues, psychological issues, emotional issue, health and all such things we are neglecting. But in palliative care, we address them all. So, palliative care again we will understand it is a holistic care where you are treating mind, body and spirit of a patient, and so well-being of a person as a whole. What is good palliative care? Again, Dame Cicely Saunders has given the definition of good palliative care. It is the palliative care which you will give to your own loved one, or the palliative care you will expect when you yourself need such care whenever you are sick. So, that is what the good palliative care is, and one must learn how to give it to your patient and your family members. Why there is a need for palliative care? There are number of reasons. Now, the demand of palliative care is very high. Because of the change in demographic of the diseases, there is a more number of non-communicable disease we see in our practice, and these are lifestyle disease. So, when a patient is suffering from non-communicable disease, at one stage it becomes incurable. There will be lots of disability involved like hypertension, diabetes, stroke, kidney disease, heart disease, etc. Secondly, there is a rise in incidence of cancer and HIV AIDS, and these are the life limiting illness where a person becomes incurable at one stage of the disease and they need palliative care. There is an increase in life expectancy. Previously it was 57.8 years, now the life expectancy is almost 70 years. So, more older population in our society and more lifestyle diseases like hypertension, diabetes, liver and kidney problem, and this older population is likely to have a disability during last few years of their life, and they will need palliative care. Secondly, there is a change in dying process. Everybody, most of our patients die in hospital, even if they are suffering from incurable disease, or even if they are from the low poor socio-economical status. If you know palliative care well and put your end of life care in practice, then you can decrease this hospital death. That will save many resources, hospital resources, which can be used for the patient who are curable. So, in India there is a need of 3 to 4 people per 1000 population need palliative care. So, approximately 1.5 billion people in India needs palliative care, and out of that only 5 million has access to it because of various reasons. Who needs palliative care? As I said earlier, any person who is suffering from prolonged illness. So, that can be cancer, HIV AIDS, dementia, neurological problems like Parkinson's disease, multiple sclerosis, motor neuron disease, stroke, or end stage disease of any of the organ like lung, heart, kidney or liver, and of course old age people. So, palliative care is needed not only for cancer but even non-cancer patients. The need is very high. Palliative care is continuum of care. It can be given with all other disease management treatment itself. So, it should be started right at the diagnosis of the patient. Initially, there will be more role of the curative treatment and small role of the palliative care. Once the disease advances, becomes incurable, there will be more role of the palliative care. And towards the last stage, when you are sure now this patient is likely to die and cannot be cured, there is some this area, it is the duration is 3 to 6 months, patient needs end of life care. During that time he has many issues, many symptoms, lots of pain, many psychosocial problems which needs to be addressed. And palliative care does not stop here with death of the patient. It is a continuum of care. After death of the patient, we give bereavement support to family members. That is what palliative care is. So, it is an integrated complementary care given along with any disease management treatment, like cancer patient who is undergoing chemotherapy or radiotherapy, they can be given palliative care. It need not be that after stop of chemotherapy only you go for palliative care, it is not like that. So, always symptom control, pain management and psychosocial support to these patients, not only patient but patient and caregiver. So, there is always something I can do whenever a patient is suffering from a prolonged illness. Where it can be given? It can be given as a OPD patient. Patient can be admitted in hospital if he has got severe pain or severe distressing symptoms. It can be given in hospice during end stage of life for patient when patient disease is not curable. At one stage you cannot bring patient to hospital or hospice. That time a palliative care team visits the patient at home and give home visit and give palliative care. So, it is given as a OPD, inpatient, hospice patient and home care. How palliative care is given? It is not given only by physicians. It is a multidisciplinary team. The members of team are a nurse, a paramedic, a physiotherapist, a counselor, a psychologist, a Ayush doctor or a social worker, anybody who can be a part of the team, and they can address the various problems of this patient for giving palliative care. So, palliative care has 4 big areas which needs to be addressed. One is nursing care, pain management and symptom management. Along with that, a big part of psychosocial and spiritual support. And this is the only speciality where community people can come together to provide all this care or be helpful to the patient and family in providing this care, psychosocial support, physical care and taking patient to the hospital and many other things, you know. So, the important aspect of palliative care is pain management, symptom management, nursing care as well as community participation and communication skill which is required to provide a good psychosocial support. So, communication skill, counseling skill plays a very big role in palliative care. How you will identify whether your patient needs palliative care or not? You try to find out whether your patient has got pain and symptoms, whether your patient is depressed, he needs some psychological support, whether patient has social issues, like many a times patient does not have any caregiver, patient has lost the job, he does not have financial support, he does not have house to live, and all these are social issues. And lastly, whether your patient has spiritual issues, like he is suffering, that why I am suffering from such illness and why I am God is punishing me, all such issues. Then if your patient has this type of symptom, then definitely your patient needs palliative care, and these symptoms can be graded from 0 to 4. When the score is more than 2, your patient definitely needs palliative care. These are called serious health related suffering. This terminology is coined by WHO. When a patient is suffering from a disease, he has got various serious health related sufferings, and which should be listed down in form of this table. What is different about palliative care? Here we believe in patient autonomy. We respect patient's views, his opinion, and treat the patient accordingly. So patient can decide whether they want Ryle's tube for the feeding purpose, whether they want to get admitted to hospital, whether they want to take morphine for their pain management, whether they want IV fluids or don't want IV fluids, and also decision is taken by patient. Secondly, it is tender loving care, where patient is given more of a compassionate care, love and attention. It is a low technology and high quality care, and it is given under the socially acceptable norms. So they are always affordable interventions. It is not modern high technology hi-fi care. Patient can be treated at home in his own surrounding with the available resources, with minimum interventions and more of a care. It is always given in presence of loved one. We never say that okay, relatives sit outside and I will treat the patient, like we do in ICU. Here the patient is always in presence of their loved one, so he can discuss his problem. His loved one also can, family members can also participate in decision making and all. Concept of hospice, as I said earlier, it is neither a hospital nor a home or institute in between, where patient and family can stay till the death of the patient, and they are given compassionate care, where patient's difficult symptoms, pain and all other issues are managed, nursing care is given, and patient and family is given lots of psychosocial support, that they are having so many problems, issues related to impeding death of the patient. These are the photographs from my hospice where I am working, and we have caregivers meeting, patient, then various activities for the patient. This was one of the laughter yoga session for patient. Patient is taught how to do feeding, how to give feeding from the Ryle's tube, and compassionate care to each and everyone. These are the paintings by one of my patient who was artist, and he donated these paintings to our hospice. Thank you very much.